flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to thank everybody for coming. Need approval of the minutes from last month.
So moved. Second.
All in favor?
Aye.
Opposed? Carries. Jump into the resolutions, 821, resolution authorizing budget modification to early invention and other fees. Motion to discuss.
At the last meeting, we said we were making the motions to approve instead of bothering to say discuss.
Can we
Did
approve?
you catch that?
I didn't question it, but how can we approve a resolution that has been discussed?
Gotta discuss.
Well,
Pardon me?
No, he's talking about the minutes.
no, okay, so what, and
Oh, that's what you're talking
what
about.
Phil said is apparently there was some challenge over time that, if you do a motion to discuss, then you need to do a second motion to approve. If you do a motion to approve, then you can discuss.
So you should do the
It's the
motion.
same thing, we just, it's just,
Eliminate.
it was just terminology.
Well, if you don't say discuss or approve, you just say, can I get a motion?
Covered?
Then somebody says,
I mean,
approve to discuss. I make a motion to discuss. That's a lot of sometimes people say
well, we
that.
always just did that early, so
Yeah.
because you're supposed to be able to have a motion on the floor for the, so I think you're right. I think you could simply say, do I have a motion for this resolution? Because the assumption is that you're gonna have it for an approval. But apparently saying the word motion to discuss is something we should do.
Where'd that come from?
Phil, some
In the
expert
last
from
meeting,
NISAC or
each
something,
Okay,
an expert in Robert's rules.
there you go. Then
A motion to,
just a motion.
just a motion.
Just a motion.
Yes, I'll make a motion that for resolution 18.
Second.
So moved.
All in favor?
Well,
Discuss
that's
first.
not discussed.
See, that's where it gets messed up. We don't do discussion.
Well, we could do both.
Anyways,
I think we have both.
we got this covered, so. You're,
That took us 5 minutes.
Illinois took us.
Well, there's only one resolution.
Yeah.
So we're requesting $30,000. This funding is needed to pay for the program costs through 2025. The increase will be offset by several revenue sources within the budget, including direct services, the escrow, and available funds in transportation and other supplies.
Zero plus.
I got a question. Legislator Klein.
Will we, to be able to find the money, the $30,000 peanuts, no, it would be say, but will we over budget that much in these particular areas? Somebody got it. We've got voted too. Either we have or we didn't. There it is.
Yes, but some of the things we budget just in case we need them, like mileage. If a county vehicle goes down, we budget some money there. But I'm looking at this, and I think direct service cost revenue is gonna give us money, which, right, but I think this is not the correct info memo and budget map that's in here. Because this one says mileage, and I believe we had to change it to other fees and services.
That's got to reflect in somewhere on this resolution.
It's on your resolution, it's not on my documentation. Because everybody say the same thing.
No.
Mileage instead of other fees and services.
So we just, we have to amend, we have to amend the budget mod, not the resolution. Resolution's correct?
No, they both should say other supplies. Sorry, not other fees and services. So mileage is incorrect, and it should be other supplies.
On the information memo or on the modification?
On both.
It says other supplies.
$3,000
increase to other supplies.
Yours can't be something.
Maybe we
You might
got
have
a
a
new,
different printout than you
maybe we got a
guys
new
have.
packet.
Oh, maybe you have a different packet than I have.
I received mine out of the office, so.
This, I know, I got mine from the email, so this is different. Okay.
So
I
right
just
now,
must have it in-
Just tell me what we gotta do to correct this.
what we have is, it says other fees, 10,000.
Yes,
It says direct revenue, 10,000.
Yeah.
It says ESCR, 7,000
okay,
to decrease transportation, and 3,000 to decrease other supplies.
okay, that's correct,
So
okay.
that's correct.
The version I have is it.
Okay, so, I'll make a motion that we amend the budget modification.
I'll second that, to make sure it's right.
Well, let's be clear. Okay, so.
So the
motion's got a
mileage-
second, what are we correcting?
We're just changing, we're aligning the budget modification request with the resolution.
Which specifically requires.
So the mileage should be on the budget, not
Correct. That should be
other supplies.
other supplies,
So.
Okay.
And then the appropriate account number needs to change.
correct.
So that motion's made.
All in favor?
And
All in favor? Aye.
any opposed? Okay, so now we're on to
Yes.
just the resolution, so
Now, don't we go back?
Yep.
As written, the resolution
amended resolution.
is amended. Favor?
Well, Richard was getting his question answered.
Richard?
Now I wanna hear it.
Question, now that I have the right thing.
Yeah.
So transportation, we had budgeted transportation to provide, to pay for parents to transport their children. And we had just started that at the end of 2024. And so we had budgeted too much there, yes, because we weren't sure how much we were
So when we see the budget in a month or so, that line item should be lower, correct?
correct. It will be correct, it is. And then the free revenue line will just be increased revenue that we receive from providing extra services. Because this is really due, if we had an increased number of children and the quantity of the services that they're receiving. We had to add on 163 services in addition to another 43 children.
Is it the school district that determines who qualifies for this?
This is the 0 to 2 years old children.
Well, who determines who they are?
We do along with the doctor's office, or whoever made the referral.
So, okay, not school.
It's an early intervention program. This is state mandated
That's right, they're not in school yet.
Right.
That's Joe.
preschool, so it's the school determines.
Yes.
Right, the 3 to 5 program is the one that we have, where we're past. For
Communication, this child needs help.
anybody can make a referral, a parent can make a referral, a physician's office, mostly physician's offices make early referrals to children if they see that there might be a delay or a disability.
Mike,
Well, all these children do, go under in their, it's the Disabilities Act, and it's defined by New York State's guidelines. So we follow New York State's guidelines.
well, you have to do that, I understand that, just one of the ones making this determination, because obviously, as a school, kid isn't football. This is 0 to 2.
Yeah, they're not there yet. So the program that's after that, it's,
We are, the school that runs the 3 to 5 program, the preschool program, which is another state mandated program.
They think it's reimbursable.
Yes, yes, that's why the revenue lines were increased, and that, yes, that's why the revenue lines were increased.
And I don't know if you have the answer or not. Why would it be such an increase? I mean, yeah, I know because they have babies, but, I know that answer. But where did these people come from that all of a sudden now we have additional amount. You usually have, last year we had this many, this year, we go off what we've had in the past years. I'm just wondering, did we get, that big of an increase in our population? Mothers coming into this, coming into the county, or?
I think that's.
Okay, I just
It would
wondering,
be determined on life first.
and as far as Richard's question, did we over budget? Well, it's better to have it, and not need it. We can move it around and not have it, and need it. Then, I know, whether we watch our budget still closer, but, that amount of money, $10,000, 5,000 or 7,000 there, that's really, I've always been accused of micromanagement. That's really kind of watching micromanage when you talk about that kind of money. But I hear what you're saying, Richard, why we, it's big amounts that I question.
Well, if you add up all the little amounts in every little department, that amount is big. That's my point.
Vote with me next time.
This is one of the most expensive programs that we run.
Now I'm going to bring that up, Richard, and don't think I won't.
I very well.
I'm all set. I'm good to vote. I wasn't going to vote against it, that's why I said.
Yeah, we're, yeah.
Any discussion?
All in favor?
Aye.
Opposed? Motion carries. Resolutions.
Budgeting is budgeting. You're estimating. You're saying that's the first time that you, were providing that transportation? Okay, so, thank you.
Tell us about the measles.
Yeah. So the New York State Department of Health announced on September 27th that a low level of measles virus was detected in our wastewater sample in the city of Oswego and surrounding areas. The sample was collected at the treatment facility and serves part of the city, SUNY Oswego, and nearby areas. Currently, there's no cases of measles been reported in the county. A positive wastewater test shows that someone in Oswego County recently had measles. But it does not mean there's an outbreak. Wastewater monitoring acts as an early warning system that can be detected, can detect signs of virus before any local cases are confirmed. It might give us 2 weeks head start to start preparing. Additional testing is in progress, so you know. Wadsworth is running additional testing. If you ask me what testing they're running, I don't have that information. I believe it would be sequence testing to find out more about virus.
Which do they test just randomly for all viruses, or is it just it pops up a virus and then they got to determine which one it is? I'm just curious.
COVID, flu,
Is there a list of
MPOX.
them? Okay.
We're one of the only counties that have the wastewater treatment plant that is actually doing this testing.
Can it be isolated there? Can we tell where it came from?
Yeah, the city of Oswego on the website, that's what I know. Yeah, that's what I know. Anyone that has a septic system, it would have to go through the city.
How long does it
Treatment
live?
plant.
How long does it live?
In the system, for a long time, it can be detected for weeks after. Mhm. So I anticipate, if they do run more testing, we'll still see a trace, sample, if not, maybe a heightened, sample with the next testing. It is pretty big stuff. So, just so everyone knows that more testing is in progress with the states running more testing. We've also been in contact with our local hospitals, healthcare providers, SUNY Oswego, all the school districts, daycare centers, EMS, and fire have been notified just to be on alert. Measles spreads very easily in the air. It is an airborne infection, And, anyone that coughs or sneezes, the virus can be spread in the air and it can stay in a room for 2 hours after the person leaves. That's one of those diseases that is very, very highly
So
contagious.
it's almost as sensitive as
Probably worse.
More so.
more so.
Yes. Even a single case can quickly spread among unvaccinated individuals. A person with measles can transmit the virus to others beginning 4 days before the rash appears and up to 4 days after the rash goes away. The incubation period for measles is usually around 7 to 14 days. So, symptoms can appear for up to 21 days after exposure. Put this information out there, just so everybody knows, and anyone watching the video can know also.
Sorry if I could ask a question. Do they still require these vaccines to go to school?
They do,
They do.
2 MMRs to enroll in school. Yes. It's also, the information we're putting out there is also really important on, to recognize the symptoms of measles. Measles usually starts with fever, cough, runny nose, red and watery eyes. The rash often appears usually days later, beginning on the face and then spreading to the rest of the body. The rash may be accompanied by fever and can spike up to 104 degrees Fahrenheit, which is very high fever. Anyone with these symptoms, we are asking our public that you call ahead before you visit any clinic, urgent care, or emergency room, and that's so the staff can take extra precautions so we can get this thing contained as fast as possible. And another big message is please stay home if you're sick. You have a cough. It's better to stay home.
If you're vaccinated, can you carry it if you're supposed to?
No. So the vaccination percentage is 93% with the first dose and up to 97% protected with the second dose of vaccine. So it's very unlikely to get it if you are fully vaccinated.
Can you carry it to someone else? Even though you're vaccinated?
It would have to be, you would have their stuff on you, someone that's unvaccinated. Yes. So everyone really just take precautions.
Right.
Good hand washing, washing down any surface materials, and then you won't keep your own stuff to yourself, and then to help us contain this as fast as possible.
Very good. Thank you. Anything else?
We have really good vaccination rates in Oswego County, just so you know, we're like 87% vaccinated. It does leave a small population that is unvaccinated and they are at risk. That's measles in a nutshell.
Anybody else?
Triple E issue in Madison County. Don't look at me like that.
Okay,
What do we know about that? Because it's not like there's a million miles across to Madison County.
okay. I'm not up on the news of Madison County, so please forgive me.
No, I'm not all forgiving, but I mean, somebody died from it.
I knew that someone had contracted the disease. I wasn't sure.
He passed away.
He passed away.
Yeah, he's 69 years old.
It does happen. That's why we do what we do, surveillance and early detection of that also. And we put out press releases every week during the summer months, during mosquito season, because it can kill you.
Richard, did you hear how old the person was?
69.
I knew he was in the hospital. I didn't.
I know when yours passed, I don't face right here. So,
We've had 3.
I know, I knew.
Very sad.
No vaccine?
For horses,
I
yeah.
know, right?
No,
Sad for horses. That's what I was wondering.
no. So that's when the spraying becomes, really important, when the numbers of mosquitoes are very high. When they're very low, becomes a scary time because, you know, the disease is still out there. So wearing long pants, using insect repellent if you choose to. Them are all really important things. People want to be outside, especially now when the weather is beautiful. But the disease is there and it remains there until the first really good frost.
And yeah,
And we have not had that.
we're not gonna have.
Maybe Wednesday night, Tuesday night into Wednesday morning.
It's a short term, such a short time that
Right, but see, the thing of it is it may be frost in my house. Soil gets protected because of the lake. What does that do to the mosquito station where we are? If you don't get a kill frost, you're still going to test positive even if we had a light frost. It's got to be a real hard
It has to be a hard frost.
freeze. You
And we really want it right around the slump.
want it right around the swamp
Yes, I do.
where the water's.
I pray for frost starting in June.
Yeah, and Oneida Lake definitely provides some of the same kinds of
Protection.
mini environment, you know.
it's like a dome.
It is,
Just hold on, doesn't freeze for a while.
especially on the sunny days, warms that lake right up. And it's shallow.
What I'm amazed at is some of the reservoirs and small ponds. There's hardly any water. That's why I was going to ask them. He was talking about this report. Tourism. I heard a report that they had shut off the reservoir to fishing.
It could be, because the problem is when the water gets too warm, the fish all gang up.
Correct.
That's what they call it, like a spring hole. They'll get to the coldest place they can find, especially the trout species.
Yeah.
And they'll all gather together, and it's like, you know, it's like shooting fish in a barrel.
Right, exactly. That's why they do it.
Well, the Hinkley Reservoir up in Utica County is closed.
Is it?
Yeah, that's the reservoir for Utica City.
Right.
I also heard Lake Delta.
That's low, I don't,
They're all low.
they're all,
Yeah, Tim.
Delta's still open for fishing, you get a boat out there. So.
Yeah. So I don't know. Tim should have asked for a resolution to have everybody do a rain dance.
It's keeping our mosquito numbers down. We only need 10 mosquitoes in one of the pools. We have 1 mosquito in another pool. So, I mean, our mosquito numbers.
Oh, it absolutely is. Yeah, it's noticeable.
Right,
And you can actually sit out and have dinner outside in your backyard.
exactly.
I guess I won't tell you what the caterpillar looks like this year. It's kind of a review of what happened last winter. At the beginning of the winter, so we get our water back 4 or 5 feet at a time. Right.
Thanks, they're all black.
The one I saw from the head down was almost halfway, then there was a little spot, and then the tail was.
All right. It's an old wives' tale. I'll make a motion to.
Motion to adjourn.
Motion to adjourn. All in favor? Aye. Opposed? Motion carries.
Thank you.
Sorry,
you.
Sorry.
Report.